Okay. So it's 11 o'clock according to me. Welcome everybody. Can you hear me okay? Great. So I think you all know me. I'm Victoria. I'm the Executive Director of CPA. It's a very exciting meeting today, our first virtual council meeting. This is just a briefing at the beginning about some housekeeping. So as I said, for those of you that were on the call a bit earlier, if you can keep yourself on mute if you're not talking, that would be really, really helpful. You're welcome to keep your video on or off. That's up to you. If you can rename your self so we know who you are, if it's not obvious. And if you add your country, that would be great if it fits in. In terms of questions as we go through, please use the chat box and we'll get back to anything urgent that we can. We may need to get back to you via email on other questions, because we have got quite a tight agenda today. We've got a lot to get through. So appreciate your understanding with that. But thank you all for joining us. And we've got 30 people online so far. We're expecting quite a few more to join us as the morning goes on. So it's great to have people from all over the Commonwealth, and we'll be calling on various different people to talk throughout the morning. So without further ado, I'm just going to introduce people supporting today's meeting. So we've got Dr. Rao Vadlamudi, who is our chair and the president of CPA. We've got our co-chair, Roger Odd, who's the CPA chair of trustees, obviously myself, Meghna Joshi von Hayden, who is our strategic development advisor that's helped with the preparation of this meeting. We've got Nikki Darcy, our project manager, who will be replying to your chats on the chat box, and Tatiana Hardy, who is also supporting the meeting today. So welcome, and I will now hand over to Rao for his opening address. Rao, do you want to unmute yourself, and then I'll hand over to you.
Thank you, Vicky. I hope all can hear me. I hope all can see me also. Well, you know, it's indeed a great pleasure to welcome all of you to the CPA General Council meeting. And let me say good morning, good afternoon, good evening to all council members, depending upon where you are calling in from. I remember very clearly, exactly 1 year ago, some of us have met in person at the CPA General Council meeting in Abu Dhabi during FIP Congress. And that was a great meeting because we were meeting in person, and maybe I met some of the people for the first time. It was such a accelerating experience. And exactly 1 year, you know, at that time, we were so much excited about the annual conference that we're proposing and discussing in that meeting about the CPA conference, which is proposed in November 2020 in Rwanda to celebrate 50 years of CPA. You know, the meeting, I remember Tim Hanlon, you know, Amy, and, you know, all the several people who attended the meeting. But we had no idea then what would we be hit when the new year 2020 starts. Well, the new year started and we were hit by the global pandemic, which disrupted every aspect of life just within a few months and posed tremendous challenges to healthcare professionals or the world in general, and more specifically to the pharmacists. As the pharmacists are COVID warriors on the front line, and there are several casualties. Many pharmacists laid down their lives because of COVID. As of today, just to housekeeping, you know, I want to mention that there are about 32.1 million cases, you know, globally, and Commonwealth countries account for 25% of that with 8 million cases. And the country where I hail from, India, has 5.9 million cases, which is 74% of cases in the Commonwealth are from India. Well, it's testing times. CPA, Commonwealth Pharmacists Association, in the recent past and during this pandemic has made significant contributions to the pharmacy profession. And I'm very proud to be associated with the association. And these contributions to pharmacy profession and pharmacists in the Commonwealth and standing up to the objective, empowering pharmacists to improve health and well-being throughout the Commonwealth. I have been associated with all these programs. I'm seeing what is happening, and then I saw that these initiatives like Farm Aid, CW PAMS, Fight the Fakes, Beat Bad Microbes, all have done exceedingly well despite the pandemic, despite the challenges and setbacks faced by all. CPA, in response to the pandemic, has initiated CPA COVID-19 webinar series to evaluate pharmacist needs and requirements to tackle the pandemic, and made great strides in providing many essentials, right from helping communities or pharmacists and PHCs to make hand sanitizer by providing them the formula and the video and all the instructions, and also the mobile app launched by CW PAMS, which help healthcare professionals with prescribing information and antibiotic use guidelines. Currently, the app has, let's say, guidelines of FIP, WHO, UK, and a few African countries and African CDC. Probably going forward, we should make the app available all across the Commonwealth to all the countries with relevant guidelines put in, and that's work in progress, I believe. So they have launched, CPA also joined hands with FIP and signed an MOU to work on pharmacy workforce development transformation. Actually, in the last FIP, the MOU was renewed, and other significant partnerships included that are the CPA's partnership with Royal Pharmaceutical Society for sharing COVID-19 training resources, a part of our CPD platform, and also a significant partnership with Journal of Pharmacy Practice and Policy. That helps us publish our research, etc. And this is 50 years. CPA has completed 50 years. As a part of this 50 years in existence, CPA is taking a virtual tour. Particularly thanks to Vicky and Manjula, they're contacting all the people across all the Commonwealth nations and having a virtual tour, telling them what CPA is all about, and discussing with the pharmacists of those countries about their priorities and needs such that CPA could cater to their requirements. It's an exciting journey. I think we have already completed 29 countries. However, out of the 54 countries, we have membership with 37 countries, so probably another 10 or 11 stops are remaining. It was an exciting journey for me for the past 3 years as the president of CPA to work closely with the great team of CPA executives, trustees, councillors, regional representatives, CPA advisors, and the core team, of Executive Director Vicky and Senior Administrator. It's really wonderful for me, and I also believe that you all feel the same wonderful feeling of being associated with CPA. And I thank you for giving me this opportunity to speak to you, what is there in my mind, and to welcome you all. And thank you very much. And I finished my speech, and over to Roger.
Hello, everybody, and welcome to our virtual council meeting. And it's lovely to see people from all the way around the Commonwealth at this particular venture. I hope you enjoy the meeting, and I will now try and guide you through some of the main parts of the meeting and some of the formalities that we have to do. The first thing to do is to actually say that we need to adopt the agenda for today's meeting. The agenda has been slightly modified from the one which has been sent to you, because we tried to push up the item on finance because Tim, our treasurer, has to leave shortly. And therefore, the agenda will be slightly different, and perhaps we have a copy of it, which we can put on now to show you all. And I hope you can see that the finance has been moved up. Is it your agreement then, members of the council who are present, that we stick to this particular agenda as it has been modified? Please will you raise your hands to signify whether you approve of it or not. I think we've got enough approvals, haven't we, Tatiana? In that case, can we then move on to apologies for absence for the meeting, which is the next item. We haven't received any significant apologies from people, but if anybody realises they have missed the meeting, then certainly we will record their absence in the minutes and notes of this particular meeting. Can we then move on to item 4 then, which is the adoption of the minutes of the council meeting held on Monday, the 23rd of September 2019 at Abu Dhabi as part of the FIP conference, which was alluded to by our president. The minutes have been circulated and all the council members have an opportunity of approving these minutes if they were present at that particular meeting. Can I therefore ask that all the council members, if they would perhaps raise their hands if they approve of the minutes? And any of those who are against the minutes? In that case, I would then say that the minutes of the previous meeting have been adopted, but if anybody has any particular comments they wish to make at this particular stage, either let us know in the chat box, or alternatively, please will they actually let us know afterwards, and we can then make the usual adjustments as necessary if there are any factual items which need to be changed. That being done on the first section of the agenda is we now move on to the second section, which is on finance. And here could I pass over to Dr. Tim Hanlon, our treasurer, who has, through his finance committee, which is on the trustees, which has the responsibility for the finances of the organisation, to actually go through the various parts of the financial report for the year 1st of July 2018 to June 2019, which are the last accounts which was necessary.
Sorry,
Can I pass over to Tim, please?
Roger, before you do that, sorry,
yep.
Can we just go back to the adoption of the minutes in the agenda, because we don't have any hands that have been raised that have been recorded. So we just need to go back to that. Andrew's got a correction from the minutes as well. So between Roger and Tatiana, can you see people's hands going up for the, first of all, the adoption of the agenda and then the adoption of the minutes? And people can use the raising hand function on their screen, so you don't have to actually physically raise your hand if your video is off. So between Tatiana, can you help to facilitate that, please?
Okay, can we go back then to the item which is the adoption of the minutes then? Can I ask once again, I gather there is one query which has come up from Andrew.
It says beat bag microbes, page 2 of 6. Rather than bag, you might write bad. That's all, just a typo.
Okay. Right, we can change that one, I think, with that one minor alteration, Andrew.
So council members, can you raise your hands if you would second the adoption of the minutes, or propose? Are we having proposals or seconders, Roger, or are we just having raise your hands? I
think just raise your hands, or you can use, if you've got the reaction button, you can use that.
Can you just keep them up whilst, because I have to scroll through everyone. So if you just can keep them up until I say otherwise.
Okay. You've got that?
Are there any others against them?
Anyone? So everyone put their
raise your hand again.
If everyone puts their hands down and anyone against, can you just raise your hand then?
I'm not sure it's working with people who have their cameras off. So maybe if we can use the chat box instead.
Well, in the absence of any other comment other than Andrew's correction, perhaps I would say that the minutes have been adopted. Otherwise, people would have put something in the chat box.
Is anyone against? Can you just write in the chat box? Otherwise, we're going to move on. Thank you.
Right.
Is that okay now, Tatiana? Have you got everything you need?
Yes, I believe so.
Okay. Can we then move on to the finance report, and over to you, Tim? Sorry, we stopped you in full flight.
Not at all. Thank you, Mr. Chairman. Thank you, Mr. President, and to colleagues around the Commonwealth. You will all have received a copy of the inspected accounts and trustee report for the year ending 30th of June 2019. That was Annex 2 with the agenda. I'm firstly going to briefly talk you through the key financial aspects of this to give you an idea of the current financial standing of the charity before moving on to look at our financial forecast for the future. I'll just check everyone can hear me okay? Yes, great, thank you. So to give you an idea of the financial health of the charity, the actual available funds that were brought forward into the financial year ending 30th of June 2019 was £58,885. This is an increase of £1,800 compared to previous years. The charity's turnover for the year was £144,191, up from £66,008 the previous year. This means that we have significantly increased both our income and expenditure for this particular year and grown our reserves by £1,800. This is the first time that we've ended up on the previous year and is due to the significantly increased activity that the organisation has had in terms of projects and related funding that these have provided. Our current reserves policy limit is set at £30,000. This is the figure set by the trustees relating to the amount of money in the bank required in the event that the charity should need to be wound up. And that's really in the event that it's no longer financially viable. We've been depleting our reserves over a number of years as the charity has been establishing itself fully. So the fact that the reserves have grown over this particular year is good news and an indicator of how much the organisation has grown. Next slide. This slide provides you with an overview of the income and expenditure during this financial year. As you can see, the majority of our income can be attributed to restricted funds. It's important that you understand that this means funds which are attached to particular programs and deliverables or agreements as to how they should be spent. The biggest proportion of funds here has been provided by the United Kingdom's DHSC's Fleming Fund for us to deliver the Commonwealth Partnership for Antimicrobial Stewardship, known as CWPAMS, that programme. We also received income to support our annual Farm Aid scheme from GSK and several trusts and individual donations. The Beat Bad Microbes project also brought in funds to specifically support this initiative. Once again, the Royal Pharmaceutical Society in the UK provided a grant to support the staffing of the charity, and we are very grateful for their continued support. In terms of unrestricted funding, you can see that our main income sources are membership organisation fees and individual membership. These funds are absolutely vital for us as a charity, and we depend on these to remain functional. So thank you all for your continued support. In terms of our expenditure, you will see that the restricted and unrestricted expenditure is in proportion to the respective income. For more details, please, as I say, refer to that report at Annex 2. So in summary, this has left us in a good financial position as we entered our new financial year on the 1st of June 2019. So I'll now go on to talk about the financial forecast for the year ending 30th of June 2020 and the budget for the current year, that is ending 30th of June 2021. The accounts for the financial year ending 30th of June 2020, so just finished, are currently being compiled for inspection and approval by the trustees. But based on our provisional calculations, I should just underline these are the provisional calculations, we are predicting a total of £56,984 in terms of actual funds brought forward. This is a reduction of £1,901 on the opening balance compared to the previous year. In essence, we are predicting that we will have overspent this year by pretty much the same figure that we accumulated into reserves in the previous year. A more detailed breakdown and analysis will be available when the full accounts are finalised and submitted to the Charities Commission in the next few months. Moving on to an outlook for the current year ending 30th of June 2021, based on a rolling budget and the knowledge that we have about our current activities, we are predicting that the funds to be brought forward at the end of the year will be £44,674, a significant reduction of £12,310 compared to previous years. This is based on an income of £50,402 versus expenditure of £67,712. This is a worst case scenario according to the predicted impact of COVID-19 on our funding streams and the conclusion of some of our projects that brought income to the charity in previous years. This leaves us in the current financial position of needing to source a predicted £10,000 to £15,000 this year to break even. We have created a funding plan based on this need and have many projects in the pipeline that we are hopeful will bring in funds, but we are aware that this income may be delayed due to the current pandemic that the President mentioned in his speech. Your membership fees and donations at this time are more critical than ever, and we thank you and the countries that you represent for your continued support at this time, when globally things are very challenging indeed. So thank you for your attention, and I'd like to hand back to Roger for the rest of the agenda. Thank you.
Thank you very much indeed, Tim. I think that's given hopefully everybody an understanding of where we are with the funds and finances of the organisation now. The finalisation of the accounts will obviously be done by the trustees, who has the responsibility for this, but we will pass any of this information to anybody who has any question that they want to actually sort of raise at some stage. But if you wish to raise any particular point, please will you put it onto the chat box, and at least we know that we can take this matter up with you at a later stage. But can I thank you, Tim, and also the Finance Committee of the trustees for sorting out and indeed presenting the accounts with the help of Tatiana and Victoria as well, which we found was very helpful in getting those accounts together. The final section in this particular area of the agenda is to do with membership. And as you heard, it's a very important thing that we need to establish and get more members involved within the organisation and the various countries around the Commonwealth. So can I then pass over to Vicky, who then will now go through the section on membership.
Thanks, Roger. As Tim mentioned, membership is very important to us. It always has been, and we have traditionally focused on the membership of member organisations, and that's really where we still sit. So it's really important for us to be building the capacity of those member organisations, and that's what the majority of our work sort of entails, by engaging those member organisations versus individual members. So this is the 50th anniversary of the Commonwealth Pharmacists Association, as has been mentioned before in Raoul's speech. We embarked on our virtual tour to visit all of our member organisations around the Commonwealth this year. and we were a bit ahead of the curve, if you like, because we did this we embarked on the virtual tour before virtual became the thing because of obviously the COVID pandemic. Everybody's gone to virtual, so I like to think that we were ahead of the curve. But we have now visited 29 of our member organisations, and we've got lots more lined up. So it's been great to connect with you all, and I look forward to some really great conversations as we go forward. If anybody wants to follow our virtual tour, there's a hashtag here, hashtag CPA 2020C. If you type that in on Twitter, you'll be able to see our progress, and there's also a report on our website about what we've been doing. So the tour highlighted our member achievements and needs. We asked people to give us 3 achievements and 3 needs as a result of the tour. And we were really blown away with some of the achievements that our organisations have had, especially some of the younger, smaller organisations. Talking to Brunei just recently, they're making exceptional progress for pharmacists, and they're graduating their first cohort of local pharmacy graduates this year. I know that a lot of other countries have also established their first pharmacy schools. They're looking to establish pharmacy councils. There's a lot going on, and a lot of fantastic people around the Commonwealth working on this. And we also managed to talk about the needs of these organisations, which has really helped to direct our strategy. And we are currently analysing what those collective needs are throughout the Commonwealth, but also there's themes coming out regionally. So what we've been doing is establishing a research team. So this is our research team here. Amy's been well established on this for the last kind of 4 years, really. She was one of the first people that joined us. But we've also added Rabia, Hussein, Aisha and Gizem, and they're really looking at the outcomes of this tour and how we can help to support creating evidence and how that evidence can be used for advocacy and policy development for countries around the Commonwealth. I should mention here that we are very, very lucky to have Claire Anderson and Professor Barber who helped to support this research team and our research initiatives. So a big thank you to them, and I think we're going to have some really great publications coming out in the near future. So just an update on membership. As Rao said in his speech, we now have 37 members, which is really great. It's the most we've ever had. And we are in conversation with more, and the target is that we will get to 40 members by the end of this financial year. And then we're still trying to establish contact with some of the smaller island states here, but Nikki and Manjula are working hard on that, and our virtual tour is really helping to bring new members on board and with the engagement of current members. So it's looking really good for membership organisations here, and it's great that we're able to include the majority of the countries now in our work. We are developing a membership package for National Pharmacy Associations which highlights their benefits. This is something that will be coming out in the next financial year. And just to highlight that one of the things that we want to do is offer free membership to the National Pharmacy Association's members. And really, we see that as a way of helping to build capacity for those associations. It can be a membership benefit for them to offer to their members. And that's something that we'll be launching shortly. So keep your eyes out for that. So I'm going to hand on to myself now and to talk about the annual activity summary for the organisation this year. I have compiled an activity summary that we will send out after this meeting of everything we've been doing. But really, I just wanted to run you through a few key things, and then I'll hand over to my colleagues that will talk to you in more detail about some of our major projects. So this is where we started the year, really. These are our core activities, and they have been for a long time. I just wanted to highlight them here. Obviously, COVID-19 has had an impact on these. Our farm aid scheme has been interrupted this year, and we were hoping to go ahead with that in the autumn, but that's now been postponed again to the spring. We are very lucky that NICE have been great donors for this this year. So we are able to send out some books, but it will be in a staggered approach this time. So conferences as well have been obviously interrupted, and everything seems to have gone online this year. And we did have a convention booked in Rwanda for 2020, and this was in line with the Commonwealth Heads of Government meeting that was happening there. But this conference and the Heads of Government meeting have both been postponed. So hopefully we'll be picking up that sometime in 2021, and we'll keep you updated on that. So those two things obviously have been interrupted. Education wise, it's given us an opportunity, I would say, to run more webinars. We've done lots of webinars on COVID-19, and we're developing our digital offering for education, which we'll talk more in detail about later. And we're still running our campaigns, so Fight the Fakes and antimicrobial resistance are still some of our key policy areas. And we'll talk more detail about that later. But obviously, COVID-19 has had an impact on these things. We've noticed an increase in proliferation of substandard and falsified medicines, and also an impact on AMR. And we're currently writing a paper to address that. And we need to really make sure that AMR stays as a key focus of a global health as well, and doesn't get overshadowed in the long term by the pandemic. We have been doing a lot of advocacy. Obviously, this has gone a bit more virtual. We've had a lot of publications coming out, but we haven't had so many face-to-face meetings. But Amy will talk a bit more about that in detail. So some of our recent global activities and events here. This is just an overview. So in terms of splitting it up, I've split it up into practice and education resources, knowledge and skills, and advocacy and campaigns. And you can see here we've been really very busy over the last year. We've got a digital education platform that Manjula will talk a bit about in her talk, and we've also been able to work with the RPS to supply some CPD resources for our members. We have obviously postponed farm aid, but in terms of digital prescribing support, we've got an antimicrobial app from the CW PAMS work we've done, and we have managed to run online events, even though our joint conferences have been postponed. I'm going to talk a bit more about the COVID-19 response in a minute, so I'll skip over that. Moving on to the knowledge and skills exchange section here. Obviously, CW PAMS, the Health Partnership Scheme here has been a key part of our work, as so has the Global Health Fellows, and Diane will talk a bit about this in a few moments. We've managed to provide 2 internships, or 3 internships, I should say, these last couple of years. And it's great to be able to have Wei-Ping and Omateo on board. They've been amazing in supporting our projects. So thank you, big thanks to them, and I hope they've enjoyed their experience being involved. In terms of digital communities, we've created many different communities now. We've got WhatsApp groups, we've had Telegram groups, and I think that's been a real key in bringing people together during the pandemic, especially for support. So moving on to advocacy and campaigns, evidence creation is one of the key things that we will be focusing on in the future. And I think we see this as a very important aspect of creating evidence to ensure that we can input into policy, and we've got evidence that countries can use to help to advocate for the profession in their countries. So we've been creating surveys. There's a publication repository that will be put on our website shortly to demonstrate our activity in this area. Health promotion resources, obviously we've got World Antibiotic Awareness Week. We'll be talking a bit about that, as well as the Beat Bad Microbes campaign and our work in substandard and falsified medicinal products. we will talk about that in more detail in just a few moments. A virtual tour of the Commonwealth, I've already spoken about, and Amy's going to update us on our policy forums and advocacy work that we've been doing. So there's quite a lot we've been doing, which is, I think, quite incredible, considering that we only have one, the equivalent of one full-time member of staff employed by the charity. So I think thank you for all of your inputs and for all of our consultants and advisors and volunteers. It's been a really busy and productive year, so thank you. So this is probably one of the most exciting highlights of the year. We held our first virtual CPA quiz, and I had to mention this because I think it was really, really nice to be able to get people from around the Commonwealth, and especially our councillors and our staff, involved in something that was fun and social, and hopefully we'll be repeating this in the future. And well done to our winner, Anna Arroyo from Dominica. She knew so much about the Commonwealth. It was quite impressive. So thank you. So I'm now going to move on just to talk a bit more in detail about some of our programmes. So I'm going to kick off and talk about our COVID-19 response before handing over to my colleagues to talk about the programmes that they have been involved in. So COVID-19, obviously, it's been a very challenging year for all of us and our families and colleagues around the world. We have obviously recognised the huge response from around the Commonwealth, and pharmacy teams have really stepped up, and they've worked in solidarity with their communities, with each other, with multidisciplinary teams. It's been incredible just to see what you guys have been doing. And, you know, we've just done a small part really through creating tools and resources and networks to help support you guys at this time. And I hope you found that useful. And your work is just so important, keeping communities together and safe, especially in some of the lowest resource countries. So we really recognise the amazing contribution that the pharmacy profession has made at this time. So the CPA's response to this was to survey our members to see how we could best support them at this time. So we were responding to actual rather than perceived needs. So we sent out a survey and we had a good response to that. We had over 545 responses from 31 countries, and the top 3 things that people were asking for was access to a community of support, webinars, and signposting to COVID-19 resources. So we've created on our website, as you can see here, this is the landing page, some of these requests. So we have dedicated support, and you can join a Telegram platform that's been very active during the peak of the pandemic, where pharmacists from around the Commonwealth have been able to come onto that platform and support each other and discuss you know, what they are doing, and if they've got questions that they want to try and get answers to from their colleagues around the world. And that's been a really good community. We've run 3 COVID-19 webinars that have been extremely well attended from pharmacists around the Commonwealth. And as you can see here, we've got lots of different resources online to signpost people to different pieces of information to support the COVID-19 response. Some of the other things that people have asked for are training on preparedness, communicating key messages, and advocacy. And I'll let Amy talk a bit more about the advocacy that we've done around this in her part later. So that was an overview of our COVID-19 response. As I said, we've got this Telegram of practice, and we've run a webinar series that was intended by over 1,000 pharmacists around the Commonwealth, the resource repository, and we've also got a section on COVID-19 now that has been added to our antimicrobial prescribing app. And this really allows healthcare professionals in low and middle income countries to be able to access these guidelines offline and hopefully supports their practice. Many of you will probably have seen the hand sanitizer animation that we've created with support of the Commonwealth as well. If you want to watch that, there is a link to it on our website. And we've been really encouraged seeing countries both in the UK and countries overseas using that to support the production of hand sanitizer. We, as I said, have a collaboration with the RPS looking at the COVID-19 clinical resources that they have for pharmacists, and we were able to provide those to our members for free as a CPD resource. There's also been a big opportunity for pivoting of the CW PAMS projects, which Diane will talk a little bit more about later, and using those networks to support the COVID-19 response. So moving back to my 10 years in Asia, I like this slide a lot. A crisis in Chinese is a combination of the characters for danger and opportunity. So obviously it's been a very challenging time for us all, but within a crisis there is always an opportunity. And I think that this has been a great moment for pharmacy in terms of demonstrating how we are experts in medicine and essential key workers. And I've put a tweet up here just to show you, for those of you that don't know, how the royal family picked up on our virtual tour and has tweeted here about, you know, how we are key workers within this pandemic. So we are helping to raise the profile of pharmacy and, you know, the great job that you're doing around the world, especially at this time. As experts in medicines, we've really come into our own as well. We've had many stories from around the Commonwealth about hand sanitizer manufacture, for example, where there wasn't a hand sanitizer on the shelves and pharmacists are working to produce for their countries. I think Anne gave us a really good example from South Africa, where some of the universities have actually turned their labs into manufacturing facilities and were able to produce hand sanitizer for their communities. So, you know, we are experts in medicines in many ways, but we shouldn't forget that, you know, we are experts in the production of medicines as well, and medical resources like hand sanitizer. So we're also highly skilled medical professionals, and I think this has really been highlighted during the pandemic, and we've been the go-to profession for the health services in many places. We've been asked to step up in many ways, and digital technologies have really supported this. We've been able to accelerate changes in legislation and the use of digital technologies to facilitate access to medicines for patients. For example, in Malta, they now have a scheme called Pharmacy of Patient Choice, where they have where patients can register with a pharmacy, and then the pharmacist is allowed to dispense repeat prescriptions without the prescriber actually signing prescriptions for those repeats. And I think, you know, that was something in the pipeline for a while in Malta, but the pandemic has really sped that up and really been able to demonstrate how pharmacists can be a valuable resource in this aspect. And let's hope that this continues after the pandemic. So I think it really is highlighting, you know, how the pharmacists are often the most accessible healthcare professional in the community, and they are very key to access to medicines and healthcare resources. So moving on to my final point here, obviously the most accessible health professional in the community, we're in a key position to help with any vaccination schemes that happen as a result of COVID-19. And I know that there's various schemes around to train pharmacists in this, and we really need to put our hand up here and say, look, we can do this and support each other, because this is a key role that we can play moving forward. Okay, so moving on, I'd like to hand over to Diane and Sarah now to talk about the AMR programs that we've been running. So Diane, do you want to unmute yourself and then I'll...
Thank you, Vicky. Can you hear me?
Yes.
You can move on to the next slide, please. So between Sarah and I, we will take you through the next few slides to share with you, particularly our key activities on antimicrobial resistance and antimicrobial stewardship, and how we've been supporting other colleagues within the Commonwealth, and particularly 4 countries who have been part of the Commonwealth Partnerships for Antimicrobial Stewardship. And I'll also share with you our Global Health Pharmacy Fellowships and also World Antibiotic Awareness Week. Next slide, please. This is the core team that has been working on the CWPAMS program. And as you can see there, it's myself, Vicky, and Sarah, but we've also had our project managers, Chloe, who some of you will know, who's currently doing her PhD, but she was the project manager for a year and in the initial part of the program, and based herself in Ghana for 3 of those months, which was an incredible support system. And we now have the amazing Nikki with us now, who has been supporting and helping to project manage that. In addition, we have had the support from 3 interns. So Ayo was initially an intern, but she's now a reporting and technical outcomes officer, and Waping and Omotaya as the interns. And together as a team, alongside other advisors, we've been able to help deliver this amazing program. Next slide, please. And I'm going to hand over to Sarah now to talk you through some CWPAMS activities, and then she'll hand back to me.
Thank you, Diane. So I won't go into too much detail. I'm hoping many of you remember the objective of the programme, which was to support the partnerships in the 4 African countries, Ghana, Tanzania, Zambia and Uganda. It's really been going, it's been a work in progress for sort of 3-4 years, but really over the last 2 years, this has really been making some progress. And the project outcomes focuses are listed in the slide. Next slide, please. I'll let you read the detail of this after the event. We will share the slides, but the slide really just gives an overview, a taster, if you like, of some of the CPAMS tools and interventions that have been developed as a direct result of the programme. Robust evaluation of the programme has been applied. We all know it's not just good enough to say what we're going to do and expect people to believe it's going to make a difference, however much we believe it. We need data, and through this project we have data, we have a lot of data, and it's been thoroughly evaluated. Applying behaviour change techniques has been absolutely key all the way through this project, with the interventions and measuring our successes, and that, I think, incorporating health psychology approaches in behaviour change has really impacted. Vicky's already mentioned the app, the CWPAMS app. This is very innovative and it has achieved a lot of interest across the world, not just in these 4 countries. And as Vicky mentioned, it now has a section on the COVID response. Next slide, please. As I mentioned, the programme has been evaluated. The overall score from the evaluation was 78%. And essentially it's demonstrated that the health partnership approach worked, was sustainable, and has returned benefits to the NHS. And I know that may be more relevant for those of us who live in the United Kingdom, but actually in terms of funding, because this was UK funding, that has been key in getting people on board. And I have to say, at the beginning of the programme, I went to speak to the Chief Pharmacist for England to say we need to get the Chief Pharmacist on board with this because we're going to need volunteers. And it's so pleasing to go back with the data and say this has returned benefits to the NHS, as well as all the other benefits. Next slide, please. Again, you can absorb this slide later, but the outcomes of the programme have been really far-reaching. The data breakdown is shown in the bar charts. We looked at to what extent low and middle income health institutions and workforce improved AMS and prescribing practice. 1,500 health workers trained. It was fairly clear from the evaluation that the thorough scoping that occurred initially was performed prior to initiation with both academic rigour and the country-specific input really informed the project design, which in turn led to much more impactful results for antimicrobial stewardship. And just finally, I want to talk about one, it's hard to pick one, but the Zambia-Brighton partnership. Through the CPAMS programme, they were able to rapidly scale up the production of alcohol-based hand sanitizer at the point where there was a global shortage of this, because the guidelines were in place and being used. But more interestingly, I think in many ways, is that our Zambian colleagues taught students at the University of Brighton Medical School how to make an alcohol-based hand rub, which was then used in the NHS in Brighton and Sussex. True bi-directional learning, absolutely, inspiring. And I will now, just before I hand over to Diane, this is just literally working on this programme has been the highlight of my career so far, and it's been such a privilege to work with CPA on this. Diane will now finish off by telling you about the CPAMS Fellows. Next slide, please.
Thank you, Sarah. So in addition to the core programme, the Chief Pharmaceutical Officer for England recommended that we should have some fellowships. And this is an opportunity for us to build leaders within pharmacy that are focused on global health. And these are the very first global health pharmacy fellows in the country that are formally recognised, and they have gone through a rigorous year of training. So obviously they all went to one or more, well, they all went to at least one country, and they had lead role in one or more projects within their overall project plan. And then they had dedicated training days by both CPA and HE. And then they also went through a leadership course. Next slide, please. And this was a partnership between HE, which is Health Education England, and CPA. And CPA's role was really for us to, we provided that expertise in helping them to develop in their global health knowledge, global pharmacy, and also to connect them and to build those relationships, help them build relationships with their counterparts in Ghana, Uganda, Tanzania, and Zambia. So whilst this leadership program was for the UK pharmacists, we've used it, it's provided us as a basis and a baseline that we could potentially roll out. And I know that one of the fellows, who was CPA's fellow, has done some scoping on what mentorship could look like and what a leadership program could look like for pharmacists in other countries of the Commonwealth. So we're really looking forward to how we can take that forward. Next slide. So we had their final graduation event, and this photo was taken from there, and it's become our favorite photo because thanks to Sarah. So Sarah has worked in Ghana before, and Emma Foreman as well. Both of them worked for many years in Ghana. And so they came up with the idea that the fellows should come dressed in either an attire or something that reflects the country that they've been to. And obviously you can see Yvonne there, who's a councillor, but others of us have just come through. They've got, some memorabilia that they got from the countries they went into, and it was just really amazing to then be able to pull together this collage. So the two gentlemen at the bottom right there have got pictures from Tanzania behind them, the ladies at the top, Uganda, and then Ghana. You've got a little bit of Nigeria there as well, and just a mixture of I think India as well within that. So people reflecting the global health nature of members or of participants. Next slide, please. So they had their fellowship event and the final graduation, and within that they were asked to discuss the impact of fellowship on the fellows. And also at that event, Winnie, who's from Uganda, and Yvonne from Ghana presented a survey that we did of those of the pharmacists in Ghana and Uganda and the impact of the program on their clinical pharmacy. So we've gone beyond just antimicrobials into clinical pharmacy and the impact, and the results were outstanding. And so we're now looking to build on this and helping to increase the capacity and training for clinical pharmacy. I'll let you read those quotes from the fellows. Next slide, please. And again, Sarah talked about the benefits to the NHS. This is really important for us to be able to continue to show the benefit of having this partnership approach, and for us to get more funding, but also that the learning from this will translate to other colleagues from across the world as well. So we're hoping that by these examples of benefits, should we be able to get funding for a specific program of work around this, then we'll be able to translate that as well. And as as Vicky said, the fellows, the pharmacists in particular, have been critical in supporting all through COVID. But just to say that CW PAMS was a multi-professional program, so each partnership had a multi-professional group. But what was core to the program was that pharmacists must be either leading or a core part of the group for the first time. Next slide, I think that might be my last slide. And then just very quickly, World Antibiotic Awareness Week. We have been participating and proactively promoting World Antibiotic Awareness Week since 2016, when I became an advisor, and Vicky's been, I think that's also the year Vicky has been an executive director. And it's been really great that each year we have tools or resources that we develop that national pharmacy bodies can then use locally, adapt and use locally. And some of those tools, we will also ensure that we signpost back to the WHO and other resources that are available throughout the world. We tend to focus sometimes on social media campaigns, sometimes on webinars or training, and also often have a template press release that you can then adapt and use locally as well. And this year we're looking to do the same and extend that a bit further for 2020. So World Antibiotic Awareness Week is in November, so please watch out for that information when it comes out to you. And that's the end. I will now hand over, next slide please. I'll now hand over to Manjula and Oksana.
Thank you, Diane and Sarah. So I'm going to be talking about the Beat Bad Microbes material. Next slide, please. So following on with the AMR theme, the CPA began a partnership with the University of Reading and the Rwanda Community Pharmacists Union to produce educational resources and tools for community pharmacists in Kigali to help educate the public on AMR. Next slide, please. The materials helped with day-to-day working practices for pharmacists. They also demonstrated that the community pharmacies are ideal places to encourage people to change their behaviour in relation to the use of antibiotics. So the resources are helping to raise awareness of AMR and are designed as two forms. The antibiotic record card, which you can see here, was used for recording antibiotics taken by patients alongside with recording any side effects they experienced, and then some antibiotic advice leaflets for pharmacists to advise and give to patients. Next slide, please. The antibiotic record card is a quick guide for pharmacists to have an informed conversation with their patients about antibiotics. And these are the leaflets you can see, which are advice leaflets, which are available for pharmacists to give to patients and cover common questions about antibiotics. So these resources are available on CPA website, and then they will soon be available on the CPD platform, which kind of brings me on to the next section. Next slide, please. The CPA Continual Professional Development platform. So next slide, please. So this, the aim and goal of the CPD platform is to deliver high quality CPD programs for our National Pharmacy Association members, and as Vicky mentioned earlier, ideally for their members as a free benefit as well. So next slide, please. The platform design has been kept simple and clean with several practical features. It is mobile friendly. The content is short bite-sized modules, and it does not require a lot of internet data to access the content. We carried out several surveys with our member organisations to find out what the needs were, and these were the key needs that we wanted to make sure we brought into the platform design. Next slide, please. The courses are organised into programmes. So here on the screen, you can see on the left-hand side, the Antimicrobial Stewardship Programme, which currently has 5 courses. And on the right-hand side of the screen, you'll see that the modules, how the content is displayed in the modules. So a key feature of the content that we've been developing so far in the AMR programme is that it's co-developed with our CPA members, and in this case, with a lot with our CW PAMS partnerships. Next slide, please. Another useful feature is tracking progress. So there is a dashboard to see which courses have been started and how many have been completed and the progress in them. So once the course is completed, there is a short quiz, and on successful completion, a certificate is issued. And these certificates are co-branded with national pharmacy associations. Next slide, please. So currently we are piloting the platform with Pharmaceutical Society of Zambia and St. Vincent and the Grenadines Pharmacy Association. And in the coming months, we hope to plan to roll out to all our member associations to create more content with them and to host webinars. So this concludes my summary on BBM and online digital education platforms. And I'll now hand over to Oksana to present substandard and falsified medicines.
Thank you, Manjula. So substandard and falsified medicinal products are a priority area for the World Health Organization for the next 10 years, as they estimate that 1 in 10 medicines in low and middle income countries are either substandard or falsified. And as such, as a global health advisor and trustee, I've been working on a partnership with CPA and Fight the Fakes, which is a awareness raising campaign and alliance with over 37 global health partners, including FIP, International Nurses Council, World Medical Association, and the International Alliance of Patients Organizations, etc. And also from our members, there has been a lot of interest and requests for further content on this specific issue, because as we can see here in the slide, there is a vast socioeconomic and health impact that, again, reaches in all countries in the world, although the burden is much higher in Commonwealth countries. So if we go to the next slide, in response to the members' requests to have more material related to this content, and also to align with the wider World Health Organization framework and strategic framework, which focuses on prevention, detection, and response. Key part of prevention is, of course, awareness raising and education training, capacity building. So over the past 2 years, the Commonwealth Pharmacists Association, in partnership with WHO, has been working on a undergraduate pharmacy curricula development pilot dedicated to substandard and falsified medical products, because the WHO had identified that there is a significant gap in formal training at this particular level within universities. And that's not just limited to sub-Saharan Africa, although this is where the pilot is taking place. This is true actually globally. And following this pilot, which we started the work on this 2 years ago, and this semester we are going to roll it out. After in June, we've completed the train the trainer session. So again, it's tied to, you can see here on the slide that WHO is leading this through an informal technical advisory structure that includes both FIP and the Order of Pharmacists. So Commonwealth, CPA fits under that, as well as the Francophone Order. And the 5 pilot universities that we are working with is the University of Douala in Cameroon, in Senegal, in Nigeria, Tanzania, and Uganda, with, of course, leads from those universities helping to develop the content for this. The idea was for it to be run face-to-face, but like in all sort of education elements going forward, including at UCL, which is my home, we've had to move to online teaching. But there is also a Moodle page, and I've included that link in the slide as well to show you what that course content looks like. There are 6 modules in total, focusing on the again, various different aspects of prevent, detect, respond through demonstrating knowledge, attitude, and skills. So this again has been a long-term project, and we will share the results of this as we move through into the implementation stage this year. If we move to the next slide, again, through CPA's very close work on advocacy and raising awareness, because again, this has been identified as an issue that, again, public awareness, even healthcare professional awareness, has been quite low. So CPA has been a strong social media partner in getting the message out there on Fight the Fakes Week, which is every December, first week of December, and Flandry and myself also, to coincide with that, have released a publication in the New Rwanda Times to help galvanize the movement. And there have been several partnerships as a result of that that have gone forward, including taking this message to the FIP webinars, as well as the United Nations Office on Drug and Crime, which is, of course, very interested in this particular subject. And CPA has had, again, visibility in their events. Manjula had mentioned the fantastic work that she is leading on developing postgraduate training and support for pharmacists and pharmacy professionals. And in this aspect, substandard falsified medicinal products also feature in these CPD modules in partnership with Fight the Fakes, UCL, and the International Federation of Manufacturers and Associations, which are supplying technical expertise. They have, of course, in-house supply chain and technological innovation, as well as other aspects that they are supporting us with. And then finally, also to say that Chloe and I had a wonderful chance to fly the CPA flag, as well as talk about substandard falsified medical products at the Royal Society of Medicine Conference, Cancer Control in low and middle income countries. And I say that this was a big win because many of the delegates there, were interested in the work that Commonwealth Pharmacists Association is doing, but equally did not know at all actually about this issue. So although we have some fantastic initiatives, it does show that more work on the awareness raising, education and training, that's pillar 1 of the WHO strategic framework, is yet to be achieved, and universities are a natural ally in this, as well as frontline pharmacists. So that, I think, is the top line summary of CPA's work with Fight the Fakes. And I will now pass on to Amy to talk about some of the other interesting projects that have been ongoing.
Many thanks, Oksana. Great work and summary over there. So as Vicky has said, this has been a very opportunity-filled year. As with any pandemic or any crisis, as Vicky mentioned, comes opportunity. And what happened in this year was unprecedented, and we definitely made the most of this opportunity. This year was supposed to be the CHOGM 2020, was supposed to be the heads of government meeting that was scheduled in Rwanda. But unfortunately, due to COVID, this did not go ahead. But CPA made the most of this opportunity, and we actually wrote an advocacy paper, which we published in the Journal of Pharmaceutical Policy and Practice, which you can see on screen. And it has been, is top ranked in terms of its outmetric, has been accessed over 1,000 times, and has been tweeted many times and shared throughout the Commonwealth and globally as well. You'll remember last year in Abu Dhabi at a council meeting, we asked for your views in terms of what things we could take to the CHOGM meeting. And to remind everybody, there were 5 themes that were supposed to be discussed at CHOGM this year. year. This was relating to information and communications technology, trade, environment, governance and the rule of law, and youth. We were able to take all of your feedback from last year's council meeting around what issues we should be taking to CHOGM, and we shaped this up into an advocacy paper where we touched on things about the opportunity that information communications and technology could bring us, especially in this COVID pandemic, but also what we could do in terms of trade, making sure that medicines are accessible, touching on the issues, as Oksana mentioned, on substandard and falsified medicines, especially in a COVID pandemic, but also touching on things like sustainability in terms of green pharmacy and environment, expanded roles of pharmacy and how governance and regulatory bodies should be looking to support these extended roles, for example, supporting pharmacists to support COVID vaccination when a vaccine is available, and also supporting our youth in terms of schooling and our curriculum and our future healthcare workforce in pharmacy. So that paper there is cited there on screen and it's freely accessible, and we do encourage you to share this around your member organisations as well. Following this, we also had the Commonwealth Civil Society Policy Forum, and again, because of COVID, this was undertaken virtually online. On the next slide, you'll see that through our advocacy efforts, we were able to share a lot of our we were able to shape this up from the recommendations from the Civil Society Policy Forum, and we were able to get 7 mentions of medicines and references to pharmacy throughout the policy document that came out of the forum, which then became recommendations actually to the health ministers at the Commonwealth Health Ministers meeting. So there are some excerpts from the report, which again is publicly available online at the link below. And you can see that we highlighted the importance of the current health workforce, especially upskilling the pharmacy workforce to respond to new emerging threats. For example, as we touched on, expanded roles of pharmacists to support universal health coverage and the Sustainable Development Goals across all countries. On the next point, we also looked at ways that we could support vaccination and also support sharing of medicines information as well. And so we highlighted the importance of using our healthcare workforce to support and counter misinformation. We know WHO has made misinformation one of the key goals and barriers to tackle in terms of addressing the COVID pandemic. So one of the key things we said is the importance of making sure that pharmacists are used to counter any misinformation and to provide accurate and timely medicines information. Also, on the next slide as well, we should see, we also mentioned about strategies to support substandard and falsified medicines and detection and support local medicines manufacturing. And also we made a recommendation to the Commonwealth Health Ministers strongly that they need to look at innovative ways of using technology to support expanded roles. So for example, are there ways that we could use existing pharmacy programs and medicines access programs and the ways that we're already reaching out to our communities to share information about medicines, but also ensuring equitable access to medicines to all. So this is a short summary, but I'll pass over now to Vicky as well, and who will tell us a little bit more about the rest of the council meeting.
Thanks, Amy. I think everyone will agree that the projects that we've discussed in more detail here are all very exciting, and a special thanks to the programme leads and the people involved, because you've put in a lot of time and effort, I know, way above and beyond what's been asked. So thank you so much. We've got a great team, and I think that is reflected in the amount of activity we've had this year. So I'm just going to move on now and talk a little bit about the plans for the future. And it's great to say that we're running on time, which is really impressive, since we've had so much to discuss. So thanks everyone for keeping to your time. I'd like to introduce you to Meghna Joshi von Hayden here, our Strategic Development Advisor, and she's been working with me on our strategy and plans for the future. She's got a history of working at ministry level in strategic development, so she's been very, very helpful and instrumental in what I'm about to present. So I'm going to kick off, and then I'm going to hand over to Meghna. So I thought it's important for us just to recognise our position in the Commonwealth to begin with when we're looking at our plans for the future. So CPA is really in a unique position, I would say. We are affiliated to the Commonwealth, we have access to the health ministers and heads of state, which gives us a really good advocacy platform. We are part of the Commonwealth Health Professions Alliance, which is an alliance of other healthcare professionals, so we work directly with them. And we are also working with the Commonwealth Centre for Digital Health, and digital health is going to have a real focus over the next few years in terms of helping to produce helping to progress universal health coverage, because we recognise that in a lot of lower resource settings, they do have access to digital, and if we can help to facilitate the use of this, we can help to provide better access to especially health information and healthcare and medicines. So we shouldn't forget also, obviously we have our members who are the National Pharmacy Associations, so as well as being linked into the top level policymakers and our kind of partners who are other sort of multi-professional organisations, we work with pharmacists on the ground through the National Pharmacy Associations. So this is just a picture of where we sit and our unique position. Our vision here that we've tried to crystallise is empowering pharmacists to improve health and wellbeing throughout the Commonwealth. And the real outcomes that we want to see here is reduction in health inequalities, reduction in mortality and morbidity, and improvement in wellbeing and quality of life. And this really kind of reflects in the production of healthy communities. And this is something which obviously we are aligned to the Commonwealth and the SDGs and you know, the UN and other organisations working in this area. Our mission then is to improve access to medicines and reduce health inequalities, strengthen health systems through quality medicines and services, and this is where the kind of substandard fortified medicines aspect comes in, manage the safe and effective use of medicines to improve health outcomes, and I think, you know, developing the pharmacy workforce here, and especially our work around antimicrobial resistance and having pharmacists as key players in the antimicrobial stewardship programs is something which really fits well here. And so this is all aligned to, obviously, I've said the UN's SDGs, and particularly SDG number 3, good health and wellbeing for all. And that's looking at developing essential health systems and services through, and for us that relates to development of the pharmacy workforce, and also improving access to essential medicines, vaccines, diagnostics and devices. So this is a kind of everything on a page. Our approach is obviously to work collaboratively. That's so important. Working together with our member organisations and partners and policymakers, like I've said, and that's how the position that we have in the Commonwealth really facilitates this. And we work to develop resources, networks and opportunities and deliver the things that I've mentioned before when I did an overview of our work. So practice and education resources, knowledge and skills exchange, advocacy and campaigns. And really this is our kind of end goal here, which I kind of touched on before around the development of healthier communities. All of this is obviously underpinned by our charitable objectives, which are at the bottom here. And we shouldn't forget that, you know, we are a charity, and these are the things that we have to abide by as well. So just to give you an overview of our partners, we work obviously with the Commonwealth with common goals around SDG 3 and universal health coverage for all. The Commonwealth has various different organisations affiliated to it. So we are part of the Health Professions Alliance, working with doctors and nurses and other health professionals throughout the Commonwealth as well. The Youth Health Network, which is becoming increasingly important to the work that we are doing and the work of the Commonwealth as well, ensuring that young people are engaged and we're meeting the needs of the whole community. Then be you know, maximising digital for proofing health systems and also the professional development side of things. We work with international organisations. We should mention we are in special relations with WHO, and our work with them involves looking at the quality of essential health services and developing human resources for health. And as somebody mentioned earlier, we do have an MOU with FIP around this, which we are looking at revising and developing further. So that's very exciting. And we have another work plan with WHO around AMR and supporting the delivery of national action plans. This aligns with the work that we've been doing on the CW PAMS programme. And obviously I've mentioned FIP, but you know, our partnership with them is growing, and we are working together to ensure that we are collaborating rather than reinventing the wheel, and all working together for pharmacy and creating a greater voice on the international platform. And we also have programme partners, which we've mentioned, so Tropical Health and Education Trust, Department of Health, HEE, and as our programmes develop, we will be bringing in more partners here to deliver programmes. I think this is the way forward for our organisation in many ways, working with programme partners, national pharmacy associations and their key stakeholders to really practically support the development of profession in member countries. So I'm now going to hand over to Meghna, who's going to talk a bit more about our strategic focus from 2020 forward.
Thanks very much, Vicky. So I'm just picking up where Vicky's left off, and to add to that, as she said, we're looking at the strategy going forwards, and we've taken all the work that's been going on in the past 50 years, and as it's organically grown from a charity into what is now an established international organisation that provides leadership and support across many key areas in medicines management on an international scale. So looking forwards, we wanted to see how can we best utilise the resources, the expertise and the networks within the ever-changing global health environment, and ensure that we have a profession that's prepared and proactive for current and future needs. So based on our mission and the vision that's there, we identified the core focus areas, looking at access to medicines, which is the communicable diseases. And we know that tackling antimicrobial resistance is a major area. Non-communicable diseases, as well, as we have more long-term conditions, and pharmacists will be managing those going forwards, more and more so. And then also the access and equity to healthcare. How can we improve access to healthcare, not just in terms of medicines, but in all the services that are available across the board for all different types of communities. The other core focus area is quality. We're using that as a way of strengthening health systems, both for medicines. Obviously, the substandard and falsified medicines product is a core area for us here, but also along services. How can we support their development, their implementation and governance? So that's another core focus area around the quality measures. And then we want to do the safe and effective use of medicines. And here it's patient safety and medicines optimization. We underpin all of these with the Commonwealth cross-cutting values around the sustainability of both the workforce that is developed as well as the services that are provided. Protecting the environment, we know that that's been a major area within the news for some time as well, and we want to build some of these areas into the work that we do. Gender mainstreaming is another cross-cutting value that we want to incorporate, and consensus building. These core focus areas have been identified both based on the mission that we have developed, and we've mapped these to these core agencies, the United Nations, the Commonwealth Secretariat, the Civil Society Policy Forum outcomes, as well as FIP, who are our key stakeholders and our peers. So having identified these core focus areas, we've moved on to look at which of the work streams can we spend some, we will refocus on going forwards. So we've looked at the work that's already been done, the work in progress, and how do we develop that, move forwards and build in some of the other areas or work streams that we would like to focus on. So online education is one area that we'd like to build in, and the CPD platform is a great tangible example of that. Workplace-based learning programs. We've had the CPO fellowship come through. That's been an excellent example. Are there other areas that we can now build on, develop and implement? Going to that is leadership development. We know that pharmacists are increasingly, their role is developing, and they need to be able to lead and implement medicines management from grassroots through to policy changes, and they really have an impact on their local communities. So we want to help and support and grow programs that build the leaders of tomorrow. The workforce data intelligence, this maps directly to the United Nations Universal Health Coverage, as well as the outcomes from the Civil Society Policy Forum. We want to look at where are the gap analysis, where are the needs, and already some of that work is in progress around looking at workplace-based learning and CPD programs. The digital capacity building is something we'd like to make sure comes through in all the different areas. From the policy forum, as mentioned by our colleagues before, there is a big focus on looking at digital health technologies and how they can enhance health outcomes. So we want to try and build some of that into the work that we do. And we're already doing that, again, through online platforms, networks, etc. And that aligns to some of the other work that we want to focus on around medicines information provision, both for health professionals and then improving health literacy and promoting healthier lifestyles for communities, and then building the evidence within the profession. And then going forwards, our next steps will be to take these key work streams to develop some projects and objectives under each work stream and work with our councillors. We'd like to strengthen existing task forces and or create new task forces to deliver the work streams and ensure that we meet the objectives. We are looking at exploring funding streams to finance the different projects, and also expanding our partnerships because that we can work with a broader range of expertise from different backgrounds. So if you are interested in getting involved, or you have any thoughts about the work streams or would like to add to them, please do get involved. Thank you. I'll hand over now to Roger Odd.
Thank you very much indeed, everyone. And may I congratulate you, Victoria, on your excellent team, which you've got round you, doing so many things. And I think it's been a congratulations to everybody on the presentations which they've given today. And hopefully that has been helpful to those people who are actually not involved in quite the same way with these detailed projects. But many congratulations, and may I congratulate you all in keeping to time as well. So that has been absolutely splendid from my point of view. We've now got one or two things that we need to update you today for all the members and for CPA and people who are involved with the association itself. The first thing is to talk about the patrons. We can have the next slide, please. We have at the moment 5 patrons who very generously have contributed to the CPA, and we are very proud that they've been the first patrons of our organisation. We're still looking for some others, and there will be some others, I'm sure, as a result of today, who want to be involved with the work. And all I would say is, please, could you contact Victoria, or could you contact Tatiana? And if you are unable to join the list of patrons, we will be delighted for you to do. So can we now move on to the CPA Fellows? And here we've got an announcement of 3 new fellows, which the Board of CPA Fellows have agreed to give the fellowship to. The first one is Lorraine Osman from South Africa, who's been a past council member of CPA for about 10 years until 2017, and was vice president for several years as well. She's been a member of the National Executive for the Pharmaceutical Society of South Africa, and is currently head of public affairs and editor of many pharmaceutical publications in South Africa. And may we congratulate you, Lorraine, on taking this particular fellowship, and we will have pleasure in presenting you, or make sure that you obtain the certificate, which you can see is there on the screen as well. So many congratulations, Lorraine. Time doesn't permit us having little speeches at this stage, but our thoughts are still with you, and it's nice to know that you are keeping well in South Africa.
Lorraine, are you on the line? Can you just give us a wave and like just maybe unmute and say hello? It would be nice to see you. I think Lorraine is there somewhere.
Is Lorraine there?
There I am. And thank you very much. I really appreciate it.
Oh, that's lovely. We've got you on vision now. Well done. Many congratulations indeed, and look forward to seeing you at some time in the near future again.
That would be wonderful.
Good, lovely. The second fellowship has been awarded to Nikwenti Achu, Dr. Nikwenti Achu from Cameroon. He was on the council for CPA for many, many years from 2001, and was vice president for 6 years from 2007. And he was president of the National Council of Pharmacists of Cameroon for several years in 2007 to 2011. Again, somebody who's done a lot for us in West Africa, and particularly in the Cameroon, and has been a great pleasure to actually work with over many, many years. Nikwenti, are you actually on? Because I've seen you come up on the screen once or twice. Can you just say hello to everybody? Are you there, Nikwenti? No, you're not. I think you're somewhere there. If we get hold of you, we will in fact make sure that you give a wave to everybody and say a couple of words. The third one I haven't seen today, but hopefully he is on the screen somewhere, and that is to John Chang from Malaysia. He was being on the council member of CPA from 2004 to 2010, and was president of the Federation of Asian Pharmacists, FAPA, till 2014. And president of the Malaysian Pharmaceutical Association for many, many years from 1995. But I particularly remember, and those of all of us probably remember as well, he was the organizer of a wonderful conference for CPA in Kuala Lumpur in 2007. And I wonder whether, John, you're there, because we have great pleasure to give the fellowship to you. And are you able to give us a wave and say a few things?
Hello, hello here, John here. Hi, Roger.
Hello, John.
It's nice to be here to participate, and deeply honored and privileged to be given this nomination award. And I can see that it's a solid program and a powerful team. Congratulations to all. I gladly accept the nomination. Thank you, Roger. And Tatiana as well. Hello, how are you? Anderson and many of my friends out there. Nice to meet you all here again. Thank you, Roger.
Well, I hope one day we'll meet again in the not too distant future. Anyway, many congratulations, John. So we've got,
I think, can we just go back to Nikwenti?
have we picked him up?
Yeah, I just try and unmute him to see if it works. I can't seem to turn your microphone on, Nikwenti. Can you give us a wave? I can see you. I don't think your audio doesn't seem to be working. Never mind.
Anyway, many congratulations, Nikwenti. It'll be lovely to see you again as well after several years. Can we then move on to the next one, which is the trustee update? And just to inform you about the trustees, for those people who know something or perhaps don't know who the Board of Trustees are. There are 8 trustees at the present time, 4 of whom have been nominated by the Society for their various positions, or they're on as representatives in their particular roles in CPA. But we have 4 which are at the bottom, which is Zahir, Claire, Tom and Oksana. and they were nominated to come on by the rest of the trustees, but need approval by the rest of the next APGM, and therefore it's necessary at this AGM for you to just nominate and agree that they actually are the trustees until the next AGM, when we obviously need to then decide on who actually stays on for the next period of election. This is purely a formality, and therefore could I ask that those of you who are council members, please will you indicate on the chat button, Victoria?
Yeah, in the chat box, or you can raise your hand on screen if you know how to do that.
Could you do that now if you approve of their proposal as trustees of the CPA? Raising your hand or putting something in the chat box. Thank you.
Tatiana, can you tell us when you've got enough people? So this is purely a formality, and we grandfathered these trustees on board when we moved from a unincorporated charity to the current format of a CIO. And now we need to make sure that they are supported by our members as being trustees. So this is purely a formality, and we would ask your support unless you have any objection. If you have any objection, please just write in the chat box.
I think we have enough approvals now. Thank you.
May I therefore congratulate Claire, Zahir, Tom and Oksana that you are now officially trustees, appointed trustees. Although you were before, you are now officially appointed. And obviously, thank you for all your work, and also to Tim, Rao and Raymond for their work on the Board of Trustees as well. It's been a pleasure working with all of you, and I think we're thrilled that the association is going from strength to strength. Our next item is now to talk about the executive election results, and we have now got the results of the election for members of the executive. First of all, we go to the regional council members, which they are at the moment. And these are the people who have been elected. And can I congratulate Dr. Rao, Raymond, Nancy, Marianne, Junior, and to two new ones, Mukusha Moses and to Erijo Folby. I hope I pronounced that correct, Hijiro. But may we congratulate you all on becoming the new regional council members on the CPA Council Executive. At the same time, could we say goodbye to Flandry and also Nijay for their time which they've been as regional representatives, and wish them well for the future. But I hope it's not goodbye, and I hope that we'll be able to still speak to you and work with you clearly in your particular areas of the organisation. So may I say thank you for what you've done in the past, and also welcome our two new members who we will probably meet at the next Regional Councillors Executive meeting. The next item then is to go on to talk about the presidential election, and we only have one particular nomination who has gone forward, and he actually is going to extend his term, and may we congratulate you, Dr. Rao, on actually carrying on for another 3 years as our president, and it'd be nice that you are here and want to perhaps say a few words. We've all heard from you earlier on about what you believe is the forward thinking of the CPA, and it'd be nice to hear what your views are at this particular time. So many congratulations, Rao, and look forward to hearing what you have to say at this particular stage, if you'd like to unmute yourself.
Roger, can we just announce the vice presidents first, and then we'll move on to Rao's speech? Is that okay?
Yeah, that's what we thought. Yeah.
All right, sorry. Okay then. Well, we need to then talk about the vice presidents. We've had 4 nominations, and the 2 have been successful, are Ajero and also Nancy. Nancy we're known for, and we know all about you, Nancy, from Malaysia, and it's delightful that you are carrying on as the Vice President. And to Ejiro, may we congratulate you on your election and hope that you will enjoy being a Vice President of CPA. At the same time, can we actually say goodbye to Nancy from Malta, who's been our Vice President for several years.
You mean Marianne, Roger?
Did I say, sorry, Marianne.
Long meeting.
From Marianne, we could say from Malta, to thank her for all that she has done over many years as a Vice President. And I'm sure it's not working, sure we'll still be working with you as a regional councillor, but also we'll be working with you for many years in your particular role in Malta and for various things that you've done for CPA in the past. So many congratulations to Ejiro, and goodbye and thank you very much indeed to Marianne. Now we're going to go back to our president, our new president, and ask him if he'd like to say a few words.
Thank you, Roger. How much time do I have?
You have 10 minutes.
Okay. So I'm overwhelmed, and thank you for electing me for another term as the president. The past 3 years have been an exciting journey for me with CPA, and I thought 3 years is enough. But actually, when I found that my parent association, Indian Pharmaceutical Association, renominated me and asked me to consider the contesting for the position again, I said, why not? Because I believe that I have some insights to make the association accomplish more objectives, and that I would like to ensure the involvement of all councillors and the regional representatives and member organizations in CPA initiatives and projects. As well as I would like CPA to support activities and advocacy initiatives of member organizations for empowerment of pharmacists, for achieving universal health coverage and equitable access to essential medicines and pharmacy services all across the Commonwealth. We know when we look at the Commonwealth nations, there are quite well-developed nations. There are quite well-developed nations from a pharmaceutical industry perspective. And there are nations which require quality drugs as well as quality pharmaceutical services. I come from India. I know the situation in India. We have a fantastic hub of manufacturing, which we refer to as the pharmacy of the world. Indian pharmaceutical industry exports to almost all countries in the world. But when it comes to pharmaceutical care, the care with which a quality medicine is delivered to the patient, in India, a lot needs to be done. And we are seeking support from various organizations. We're seeking from FIP, we're seeking from WHO, and as a part of, president of CPA, I would like CPA to be more involved in the advocacy in various countries to ensure that pharmaceutical services as well as quality medicines are accessible and available. Probably I'm adding another layer here, because there may be organizations, there may be countries where pharmaceutical services needs to be supported by training and by providing all the resources, but those countries may not have adequate access for quality medicine. Normally we're not talking about supply chain here, but CPA through its contacts can get into even looking at how they can supply, quality medicines to those countries which require them. We can take the CPA already has tie-ups with WHO, and now I have seen that WHO regional offices have information or machinery to mechanisms to look at trade and medicines exchange or exports. So we could get involved in those also, which would add another layer. Okay, and CPA has risen wonderfully to the challenges posed by the COVID-19 environment. However, the post-COVID environment is going to bring us another challenge. When the vaccines are made available, because there are at least 9 vaccines under phase 3 right now, probably in a short time, some of them would be approved and they would be available for vaccinating all the global citizens. So we are looking at 7 billion doses of vaccines to be given, of which Commonwealth countries, would be requiring, at least a part, if not half, maybe 25, 30% of those, and who would deliver all these vaccines. So CPA, I want CPA to be involved in training pharmacy workforce in immunization, as well as also involved in supply chain that all essential items can be delivered. And they take active part in accomplishing this objective. Then I would think that CPA would then increase its membership, its buy-in from various countries, fundraising opportunities, and enhance its footprint across the Commonwealth. With these thoughts, I thought I can, guide, or I can steer, or I can support CPA to get into that in my next tenure of 2 to 3 years. It's 2 years, I thought, Roger, but you said 3 years. I would like to take this opportunity to welcome all the new councillors, regional representatives, and vice presidents who are joining my team in the CPA Council and executive, and wish them a successful term. Together, we must make CPA a highly vibrant organization which creates value across Commonwealth by empowering pharmacists to improve health and well-being across the Commonwealth. I would also like to thank all those standing down from the position of as either councillors or regional representatives or vice presidents, and I want to place on record their support and services, which have made really what CPA today. Thank you so very much. Thank you very much for giving me this opportunity to lead the organization for another term of 2 years. I wish everybody a great success, wish them well, ask them to stay safe, and look forward to their continued engagement with CPA. Thank you very much, Roger.
Thank you very much indeed, Rao. And I think we're going to see if we can speak quickly to Nancy on her election or re-election as a Vice President. Nancy, are you?
Thank you, everybody, for the confidence in me. It's been very great experience to have worked with the CPA team. And now I'm so glad to have the opportunity to do so again. And this is really humbled by it, and especially to work with such an awesome team. CPA has gone places, and I do know that I've a lot to learn from this great organization, especially this year, which is a golden anniversary year for CPA. So this is a wonderful milestone for all of us. Let's together work to make CPA stronger. Thank you.
Thank you very much indeed, Nancy. And Ejira, are you there? I'd like to say a few words.
Yes, thank you. I want to say that I'm very grateful for this opportunity that has been given to me to perform, to serve as a Vice President of CPA. And like I said earlier, I pledge my total support to the President, the Executive Director, and every other member of the Council. No doubt there are going to be a lot of challenges post-COVID, but I know that with collaboration, with one mind, with one purpose of heart, we will be able to do so much. I believe in a lot of training, especially for us in the developing world. We need a lot of training when it comes to the vaccines that are definitely going to be rolled out, because that is like a zero area for us. So we need a lot of training, and with a lot of collaboration and everybody putting in their best, I'm sure the pharmacists will be better for it. So once again, I want to say I'm happy, and I pledge my total support, and I will do all that is within my capacity as the Vice President. Thank you very much.
Thank you very much, Ejiro, and it's been nice to see you at the first council meeting, and I'm sure you'll make a great contribution to that body. Well, it leaves me now to say thank you to everybody for what you have done in not only sort of coming and joining us, but staying with us and listening to us. And very few people have had to drop out for one reason or the other during our sort of very long conference and AGM. All I would say is it's been, I think, absorbing, and I hope that you've learned as much as I have about what the organisation is doing at the present time. I'm sure you're proud to be a member and involved with the Commonwealth Pharmacists Association, but it's really a thank you as well to everybody who is part of it, whether it's as councillors, whether it's as people who are regional representatives, presidents, vice presidents of our association, or people who are patrons, people who are fellows of the organisation as well. But particularly, I think, for the team that Vicky has produced and got round her to actually take forward so many ideas and new functions that the organisation is getting involved with. And may I congratulate Vicky for what she has done in actually getting a tremendous team round her. And I must say, whenever I sort of talk to any of them, usually on the Zoom meeting at this time, then it's great. I feel motivated that the association is going in the right direction and is actually doing very well indeed. So Vicky, may I thank you on behalf of all of us for what you've done, and to everybody who's in your team as well. If anybody wants any more information, we have really been throwing information at you over the last 2 hours nearly, please will you contact Vicky or Tatiana, and they'll be able to provide you with the set of slides and also any further details that you might want to have at this particular time. So in actually saying to you, thank you, may I say thank you all for being with us today. And I hope this is not going to be the last, but certainly the first of many communications that we want to talk to you about. But if there's anything you want to tell us, please come back. You're all part of the Commonwealth Pharmacists Association. So from me and from everybody on the team, may I thank you for your attendance today. And we hope to speak to you and perhaps see you in the not too distant future. Thank you for joining us.
Thanks, Roger, and thanks for that wrapping up. I just wanted to add my thanks to you and to the trustees and also my team. But you know, Roger's put a lot of work into today and been a great co-chair with Rao. So thank you very much, both of you. And just to let you know, we will send these slides around. I've got an activity report that will come with it, and we will put the recording on the website eventually. So if any of you want to access it there or listen to any bits again, it will be there for you. We've wrapped up on time, which is great. And I just wanted to invite any of you just to make a couple of remarks, because we've got a few minutes left. If anybody wants to say anything, please can you raise your hand, and then we'll come to you. Rao, have you got your hand up?
Is mine?
Is it not meant to be up? Anyone want to say anything else? Raymond?
I thought I said enough. So.
Okay, fair enough. Raymond, what would you like to say?
I'd just like to reaffirm what Roger has said. I think, you know, you have led a great team, Vicky. You've brought it, you know, compared to where we were, you know, whenever I took on the presidency, you know, all those years ago. And when you came in, I can remember sitting talking to you and saying, you can bring CPA and you can do with CPA. It's an organization which you can do with as you please. And basically the world was your oyster. And I think you have met my expectations and certainly superseded that. And I just want to thank you for all your work you've done, and for the team that you've got around you, for the volunteers, for the advisors. It is just great to see. And I think, you know, the reputation of pharmacy has been enhanced, certainly around the Commonwealth and beyond, with the work that you've done. So congratulations.
Oh, thank you, Raymond. Appreciate your feedback. Thanks for your support. Marianne, do you have your hand up?
Yes, thank you, Vicky. First of all, I would like to congratulate Rao and the two new vice presidents. thank you very much to all of you for giving me the opportunity to serve as Vice President of this highly professional institution, CPA. It was a pleasure working as Vice President. I look forward to continuing giving my contribution as an Executive Council member representing the European region. So once again, congratulations to everyone. Now a word to you, Vicky. It was a pleasure working with you. Well done for the team that you have around you and for all the projects that you have on. It was a pleasure to hear about the different projects today, and also during one of the webinars when more information about the antibiotic project was given. Now, something that was mentioned by Magda in the proposed strategy, I would like to emphasize the importance of working to enable equitable access to medicine and healthcare professionals, especially pharmacists, to all. I think that is something which is very close to my heart. And I would like to see CPA working more in that direction. Also, the President Rao mentioned equitable access to medicine. I really feel that it is very, very important that we work on it, and we work on this very important area together with partners and new partners, and also with the Ministers of Health of the Commonwealth.
Thank you, Madam. I appreciate
Thank you very much. Thank you.
Thank you. It's really nice to hear from you, and thank you. We look forward to continuing to work with you as part of the council.
Pleasure. It was a pleasure. It's a pleasure working with you.
Pleasure from our point of view as well, so thank you. I'm just going to ask Moses from Zambia, he's our new regional rep, and whether he wanted to say a few words here. He's got his hand up. Moses, are you there?
Hello. 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 Hello.
Hi Moses, we can hear you.
Can you hear me? Yeah. Thank you so much, Vic, and congratulations to everyone who's been elected, the vice presidents and the president. Looking forward to working with them. And I would just like to mention that as Zambia, I think we're ready to work with CPA. We'll be having our AGM at the end of this month. And also our CPD programs were just recently launched by our National Regulatory Authority for Health. So we are really active, and we are hoping to be engaging CPA in all these, because they are part of the CPD that we are producing, and we'll be reporting back. So just want to wish everyone a happy World Pharmacists Day that we had, and I hope everyone is having fun and enjoying themselves. Thank you.
Thanks, Moses. We look forward to working with you more as our regional rep as well. So it's been great to be so involved with Zambia in both CW PAMS and the CPD platform. So yeah, it's great, and hopefully it continues. Just Quenty, do you have your hand up? Time for maybe a couple more. Quenty, I don't know if you can say anything. I'll try and unmute you, but it doesn't seem to be working. You've got a message for us. Maybe you can type it in the chat box, and then we'll come back to you. Jerome, are you meant to put your hand up? I understand. Are you from Zambia?
Yes.
Great.
Thank you. Thank you, Vic. I just want to appreciate the work which you are doing in Zambia with the antimicrobial resistance, and with the issue of the hand sanitizers. I think it's good that most of the pharmacists have learned that, and the key people have been sharing and teaching other health workers, including other pharmacists from other hospitals. And
we are very much grateful that at least we add also our pharmacists who are to teach other people, like from Benin University, which is very wonderful on our part. We are just looking forward to work with you over the issue of the CPD, which we have said it will be piloted with first with Pharmaceutical Society of Zambia. Thank you very much, Vic, with your team.
Oh, pleasure. It's great to have your feedback. Thanks, Jerome. We look forward to working with you as well. I'm just going to hand over to Sarah. She's got her hand up, and then we'll wrap up, I think, because it's 1 o'clock. So Sarah, closing remarks, no pressure.
Sorry, Vicky, I know it's nearly 1. I just wanted to say thank you for your superb leadership of the CPA. Obviously, this is a team effort, but what you've achieved is phenomenal. It's been completely inspiring working with everybody across the world. The collaboration, the teamwork has been unprecedented in my entire career. I can't speak more highly of this organisation. Every piece of work I ever do with this with the CPA just fills me with joy. So thank you, everybody. We need to just get more members. We've been an example within the UK to our own government of how collaboration can actually get things done. So absolutely fantastic. Thank you, Vicky. Back to you.
Thanks, Sarah. I think it's time to wrap up, and we're on time. So thanks everyone for your feedback and your comments and your support. And I think you'll agree that we've got a very exciting kind of plan going forward. We've grown the organisation organically, really, from from the outset of establishing the independent charity. So now we're kind of trying to put a bit of a strategy around that, and really go forward with a concrete plan based on the needs we've identified by engaging better with our members. So really exciting to have you all as part of our journey, and I look forward to interacting with you all over the next year before our next AGM next year. Maybe we'll see you all in Seville for the FIP conference, and we can have it in person.
Well, thank you, Vicky, very much indeed for closing the meeting for us. But just to say thank you, Tatiana, and the team who've actually got the logistics right, and certainly it's gone very smoothly, the meeting, for a considerable amount of time. So well done, and may I close the meeting and say thank you to everybody, and look forward to speaking or seeing you all in the not too distant future.
Thanks, Roger.
Thank you, Vicky.
Thanks, everyone.
Thank you.
Team.
Thanks, everyone.
Thank you.
Thank you.
Thank you.
Thank you all. Bye-bye.
See you. Bye-bye.
Yeah.
Bye.
Bye-bye.
Bye.
Bye.
Stay safe.